Hello, I'm Carol Greenwood. I'm a professor in the Department of Nutritional Sciences as well as a senior scientist at the Rotman Research Institute at Baycrest. And I'm going to be talking to you today about diet and lifestyle as contributors to cognitive health. We know with population aging that we're going to be expecting a huge increase in the prevalence of dementia. And here's some staggering statistics that we have. That we know that there's a new case of dementia presenting every 4 seconds globally. And that's looking at over 7 million new cases each year when we look at a global perspective. When we bring ourselves down to Canada, that we know by the year 2038 that we're projecting that over 1 million Canadians, or 2.8% of the population, will be living with dementia. This is in the face of the fact that we currently have no diseases that can actually modify the disease. So we really are trying to look at alternatives in terms of dealing with the projected demographic changes. Fortunately, we understand that between 30 and 50% of dementia risk can be attributable to modifiable lifestyle factors, and that at present we believe that risk modification programs associated with these modifiable risk factors are what we really should be looking into. If we look at some of the data, here's some publishing where a group where they were actually projecting that 30% of Alzheimer's disease could be associated with modifiable risk factors, and these include things like diabetes, midlife hypertension, midlife obesity, smoking, physical inactivity, and poor educational attainment. But the important part is they also modeled in this paper that what would happen is if you could reduce the prevalence of your modifiable risk factors by 10% per decade, that would actually translate into a 8.3% worldwide reduction in terms of the prevalence of dementia. And if we could be even more successful and reduce the prevalence of our risk factors by 20%, that would translate into a 15% reduction in terms of dementia. So we know that even small gains in terms of dealing with some of these chronic disorders will translate into meaningful reductions in terms of Alzheimer's disease prevalence. And based on these types of work, we now have international organizations such as the World Dementia Council advocating for the development of public health programs as it relates to dementia risk reduction. And we can see in here from RED that they're recognizing that things like a healthy diet, as well as keeping yourself cognitively engaged, are factors that can contribute to cognitive health with aging. When we start to look then in terms of what do we need to know, it's important to recognize that brain aging actually occurs throughout the lifespan. That we know from that area marked in the red on this particular slide that in our midlife, we can already start to see pathologic processes associated with dementia occurring, but it's not until later in life that we actually pick that up in terms of changes in terms of your cognitive performance. And so that's where when we looked at the midlife hypertension, the midlife obesity being harmful, it was when it was occurring during the time where we were starting to get the pathologic changes occurring. We now, though, are having some more sobering thoughts where we think that some of this implementation may actually have to begin earlier in life. And part of that is associated with increasing evidence that the prevalence of obesity and those obesity-associated disorders are interfering with brain function and structure even in adolescence. And so here's some work that comes from Tony Convit's group where he was looking at adolescents either who had or did not have the metabolic syndrome, which is a chronic disorder associated with obesity and other metabolic sequelae. And what this table is showing is that the adolescents between 14 and 20 years of age who had the metabolic syndrome were already scoring more poorly on state exams as it related to arithmetic. And that if you looked at a brain scan, that the kids that had the highest level of insulin resistance or the lowest quickie score on here were already showing that they had smaller hippocampi, the region of the brain that's involved in terms of memory, and that was being replaced by larger volumes of cerebrospinal fluid. So even in the adolescents, we can see the negative impact in terms of the presence of obesity and its metabolic disorders. So let's flip that to a positive in terms of what can we actually be doing in terms of cognitive health. And there's been lots of information and epidemiologic studies on the Mediterranean diet. And the meta-analysis now are arguing that we can get about a 27% reduction in terms of the prodromal state for dementia or mild cognitive impairment, and about a 36% reduction in the prevalence of Alzheimer's disease for people that are adhering to the Mediterranean diet. Mediterranean diet, as we can see in the pyramid, is really, it's a predominantly a plant-based diet that's rich in fruits, vegetables, and grain. When we look at protein, it's relying on things like fish and poultry and dairy, and things like red meat, while can be consumed, they're really meant to be treats and consumed on a monthly basis, just as I say, as a treat food. The last point is to remind me to say that these benefits in terms of the Mediterranean diet are even observed in cohorts that are being studied in the US in New York City. So we're not looking necessarily at a beneficial effect of living on a Mediterranean isle, that they do translate into a North American context. We also understand very much from this intentionally messy slide that in the face of metabolic disorders, a number of things are going wrong in the brain that are both in terms of looking at metabolic abnormalities as well as damage to the vasculature, the underlying inflammation and oxidative stress are all contributing to the decline in cognitive function and neuronal death and loss of brain volume, and that we understand various components of the foods that you consume in that Mediterranean style of eating will help combat that. And we have lots of data from epidemiologic studies that are supporting that, where when it's evidence is arguing that people that are more adherent to this Mediterranean style of eating have larger brain volumes, they have less white matter damage, so that they have more integrity in terms of their blood vessels in the surrounding areas, as well as periphery lower levels of oxidation and inflammation. So we believe we understand the underlying mechanisms of why it is that the Mediterranean style food is so neuroprotective. But I think the other part that's really important to recognize here is that when we're talking about a Mediterranean style diet, we're not talking about eating Spanish and Italian foods and going out and eating pizza pasta. We're really talking about a style of diet that is rich in fruits and vegetables and grain, looks in terms of fish and poultry, and then very low and highly processed foods, and that there are a number of different ways that you can actually achieve that. And one of the initiatives that we're taking in Canada right now is developing a brain health food guide, which is going to be based on exactly those same principles. I'd like to spend the last few minutes putting this, though, into a broader contextual picture, because we know that our eating habits do not occur in isolation, that many people that have good lifestyle habits have many good lifestyle habits, and individuals that have poor ones often have multiple poor lifestyle habits. And here's some work from a group of older adults in Quebec that we were looking on and trying to understand whether there was an adverse effect associated with high sodium diets. And what you can look on the scale is the decline in cognitive function that individuals were experiencing over time, and that we can see that the older adults that had the highest and medium intake of sodium were actually declining much more rapidly than those individuals that had the lowest intake of sodium. But the important piece that's also shown on this slide is, because we're only seeing that on the left association and not on the right, is that those that adverse effect of sodium was only observed in the adults that had the lowest level of physical activity, and it was not apparent in those older adults that had higher levels of physical activity, arguing that the physical activity may actually protecting the blood vessels in a way that we can consume higher levels of sodium and not experience that level of cognitive decline. So we do have evidence that things interact, but we know that from a realistic lifestyle perspective, that typical couch potato is an individual who exists in our society. It is not only metabolic interaction that we're worried about. Here's looking in terms of individuals that were divided in the same cohort in terms of the degree of education that they attained in their youth. And we know that education attainment helps us build cognitive reserves so that we have more capacity when we age. And if we look up here on the top, what we're seeing is that those individuals that had high levels of education actually had better cognitive scores when we were testing them. But when we look on the bottom and the people that had lower levels of education attainment, not only did they have lower scores, but you can see that they were more adversely impacted, the red line, by consuming a Western style diet. So that Western style diet that's rich in red meats and potatoes and white breads, that was much more harmful for those individuals that had low educational attainment, presumably reflecting the fact that they had less reserves as they were aging. Where that becomes important at a societal level is that we know that many of these adverse behaviors, the smoking, the low educational attainment, all of those types of things tend to be more prevalent in people of lower socioeconomic status. And so that we start to look at social gradients of health, of how they may actually impact brain aging, understanding that the person of low socioeconomic status may be at increased risk, in part because they have more of these adverse lifestyle behaviors. So as we come to an end, it's really looking in terms of saying the message actually is quite simple when we look at what we need to do with brain health. We need to manage our body weights and make certain we don't develop chronic disorders. From a dietary perspective, Canadians really need to increase their intakes of fruits and vegetables. We need to make certain that we're consuming fruits or fish regularly, as well as trying to avoid highly processed foods as much as we can. So in conclusion, I hope what I've been able to tell you is that diet is an important contributor to brain health, that multiple nutrients are involved, so it's very important that we're looking at this more global aspect of the diet rather than foods or nutrients, that we also know that our lifestyles interact collectively with one another, so that if you're eating the apple today, it's not giving you permission to not be physically active, that we really need to have a globally healthy lifestyle to protect our brains as we age, and that those obesity-associated disorders are major contributors to brain injury. So I know that was a mouthful, and thank you very much.